Welcome back to the morning show here on the Rise News. Now, as people continue to return to school, work, and regular activities, we're allowing more COVID-19 testing to help us keep the risk at minimal levels. Even in the Lagos State, Governor Babashide Sanwo-Olu has said that any malaria-like symptoms should be considered as COVID-19 virus infection to reduce the spread, especially in the second wave. Now, joining us to tell us all we need to know about COVID-19 testing. Now, from types of tests available to the reliability of the tests, he's the chief executive at the Medbury Medical Services, one of the 10 accredited COVID-19 labs here in Lagos State. We have with us Dr. Itunu Akinware. Very good morning to you.
Very much for having me. It's a pleasure to be here.
Good to have you.
Yes, and first and foremost, Dr. Itunu, COVID-19 and testing. Now, talk to us. How did the laboratories side of medical services, how did they take the barrage of testing that needed to be done? Were they prepared for it? Are they still been able to cope with the numbers? Give us an in-look into how that particular sector was disrupted in this COVID-19 era.
Well, all around the world, it's been a bit of a dynamic situation. We started slowly, but I can say that we have actually ramped up testing and we continue to ramp up testing. And not just in Nigeria, everywhere around the world. Before we were even able to find the right test kits, develop the right test kits in response to the pandemic, it did take a while. But the government have been able to respond to this by accrediting private laboratories to support the public health response. So right now, across Nigeria, in every state, you can find a place to have your COVID-19 test done. So I would say in terms of the response, there's still a bit of work in upscaling the testing, but it is now widely available for those who might want to test. So I would say that as a country, we are coping. As the numbers are increasing, we are also increasing the infrastructure that is required for testing. And yes, by and large, it's been going quite well.
Dr. Itunu, tell us about actual testing now. Are there different kinds of tests?
Yes, there are. And you can categorize COVID-19 testing into two broad categories. You have the tests that test for the virus itself. So you are looking for the viral pathogen. And you also have the tests that test for the body's immune response to the virus. And this is what you call antibody testing. Now, looking at the first type of testing, which is the viral testing, which are testing for the virus itself, there are two types. The type that you have in the laboratory, molecular testing that you have in the laboratory, which takes a longer period of time. And then you also have the antigen testing, which is like the rapid diagnostic test kits, the ones that are similar to your regular pregnancy test that you can get off the shelf. Now, the difference between the two tests is the fact that in the laboratory, you are able to multiply the viral particle. And this is very essential to understanding COVID-19 testing, because a couple of people say, oh, why can't we just have the quick testing? Why don't we just have that everywhere? The problem is that the quick testing is not as sensitive because, for example, the viral particle is very tiny. So when you pick that up on testing, maybe, you put a swab in the nose or in the mouth of an individual who is taking a test, you get a very tiny viral particle. That particle may be too small to be found on the antigen test, that is the rapid test. However, what happens when you take that into the laboratory is that it undergoes a process that allows us to multiply the DNA of the virus and then allows it to be detectable. So that is why we say that PCR testing, which is the laboratory type of testing, is the gold standard. Now, moving on to the second type of testing, which is the antibody testing, which tests the immune response of the body. Now, we have two types of antibodies. There's an antibody that is generated in the body of a person who is infected about a week after there's infection. We call that the IgM antibody. And then we have the antibodies that come in a little later but stay for longer, and those are called the IgG antibodies. So It's interesting because COVID-19 infection is very dynamic. Some people never even develop antibodies, while some develop it and it's gone in a short period of time. It's really on a case-by-case basis per every individual, but those are the kinds of tests that we have available right now.
All right, Dr. Itunu, I would like to find out at what stage are we in this testing phase, looking at it closely, because I know that so many people would like to get tested randomly to just find out, to just know their status, but that is not readily available. Have we come to the stage whereby I can just walk into any of the testing laboratories and say, I want to know my status. Do I have COVID-19 or not?
Okay, that's an interesting question. Now, one of the things that we've done in Nigeria specifically is that we have developed, or we have categorized testing into a need to have and a want to have. Now, we have the public health response, and across the 36 states of Nigeria, if you go on the NCDC website, you would find a place where you can go in and have a free test. But you have to meet the case definition criteria, meaning you have to have symptoms, or maybe you have to have history of maybe contact with somebody who is positive or somebody who died of COVID, right? If you walk into any of these facilities and you meet the case definition criteria, you will be tested for free. It is currently free in Nigeria, but you must meet case definition. However, for those that just want to know, or it's not on a need to have basis, it's on a want to have basis, maybe for, I just want to check myself, or I want to travel, or I need it for work. There are private testing laboratories that have been accredited by the states and the national government and the federal government, and you are able to walk into any of those laboratories to get tested today.
Okay.
For a fee.
Out of fee.
Yes.
Okay. You've mentioned a couple of tests, and I want to look at the PCR test.
Right.
What does the result of a PCR test mean?
Right. Okay. So when you run a PCR test, you can have three outcomes. It's either it is negative, positive, or inconclusive. Now, it's important to note that the result or the outcome of a test is based on the point and the exact minute you take that test. And I say this because COVID infection is very dynamic. A person might be negative today and positive tomorrow. A person might be positive today and negative tomorrow, and I'll explain that. When you look at the disease progression and the progression of the infection, during the incubation phase, you may not detect the disease. You may not detect the infection even though it is there. With PCR testing, a person has to have been infected maybe for 2 or 3 days before you can even find it. So let's say a person gets infected today or exposed today. If they do a PCR test today, they may not be positive because the virus has not yet replicated enough to become detectable. So that's very important to note. So that test is going to come out negative. So what a negative test means is that at the point at which you had the test, we couldn't detect any viral fragments. Now, what does a positive test mean? A positive test means that at the point at which the test was taken, we could find, or we found viral fragments in there. Again, that person may be at the point of recovery, because you see, there's a thin line between when you are negative and positive and when a positive person becomes negative again.
Yeah.
So that's what, it means to be negative and positive. And sometimes you run your PCR testing and the guidelines say to you that you have to rerun the test because it's inconclusive. Perhaps it hasn't passed some of the controls or the checks. Sometimes you have to rerun the same samples, and other times you have to call back the client or the patient to come back for a retest in the case in which you have an inconclusive result.
All right, Dr. Itunu, do you think enough is being done to clamp down on unscrupulous elements who are out there falsifying COVID-19 test results in Nigeria? We know they are a danger of two legs, first of all, but do you think enough is being done to clamp down on that? And what's your message to those who actually participate in that illicit transaction?
Okay, I'll start with your second question. And my response, or what I would say to those that engage in this unscrupulous behavior, is that you need to understand that we're at war. The whole of the world and Nigeria, everyone is at war against COVID-19. look, we are not helping one another. We're not helping each other by doing that. By giving somebody a wrong result, somebody who is positive, giving them a negative result, you don't know where it's going to come back to, right? You don't know if it is a family member of yours or a friend or an acquaintance that is going to meet someone who you've given that negative result to and is going to come down with COVID and then lose their lives. It's something that we cannot play with. So I would implore everybody who is doing that you are not helping yourself. You are not helping your family members. You are not helping the country or the whole of the world at large by doing this. So it's something that we need to stop doing. In terms of what we are doing to stop it, we personally, or rather in Medbury Medicals, we have set up a verification platform where all our test results can be verified online. All you need to do is put in the code, and it will tell you whether the result is good, whether the result is genuine, whether the result is authentic or not. However, I'm also aware that the state government is putting in some systems to be able to make this widespread across all the laboratories. So we are waiting for that to happen. I know that they are clamping down on some people. Some people have been caught. We've been called many times to verify our reports. Some have been verifiable, some haven't been. So I believe that there's a lot of work that is being done, and I know that they're going to upscale this as we go along.
Okay, Dr. Itunu, you mentioned earlier that COVID-19 tests are free in government centers.
Yes.
I wonder now, some travelers, people who have to travel abroad, can they use these centers? And why are they usually referred to private laboratories as opposed to the government centers?
That's a great question. As I said earlier, the testing methodology or testing strategy is divided into two: need to have and want to have. The need to have has been kept for the public health response, for people that actually need it, and it is free. So if you want to travel, right, you do not need it, even though you want it, right? It's good that you travel, but it is not essential. So because of that, the government has to save resources for those who actually need it, who actually need testing, who can't afford testing, who are ill and maybe need quick results. So that is the reason why you cannot use the certificate from a public laboratory to travel, because traveling is not essential. Even though it is important, it is not essential. So that is being prioritized for those who are actually ill and who cannot afford testing.
All right, Dr. Itunu, in all this that we've been speaking about, there's still talks about the zero prevalence test and how it helps shape monitoring and evaluation, planning in terms of resources. Now that we're even looking at a vaccine in the works and distribution of vaccines. Talk to us about the importance of seroprevalence test. We know that we've spoken to Dr. Sani Ahmed, who has actually spoken that some has been done, but how much of the seroprevalence do we need to do? And have we done enough to be able to help us plan in this era of vaccines coming into Nigeria?
Okay, so when you say seroprevalence, I assume that you are referring to antibody testing?
Yes, exactly.
Yes. So currently now, we typically are focused on the PCR testing in Nigeria as the gold standard. As we begin to develop our testing strategies and as the vaccine comes, I reckon that in a couple of days or weeks, we would continue to develop that. But we also need to understand that it's a very difficult and emerging area, right? We learn every day. So again, in terms of antibody testing, I would say that, yes, it is good to have antibody testing. What antibody testing really does is that it helps you to know the level of how many people have been infected in a community. It's good for being able to carry out epidemiological studies, meaning that you want to know how in-depth it's going, because you know the COVID testing, for most people, they are asymptomatic. So most people do not test. But the antibody testing will tell you if somebody had been positive before. Now, this doesn't particularly affect, the use of vaccines, right? Whether we do the epidemiological studies or not, it doesn't stop us from actually still having, vaccines that will prevent the infection.
I'm talking about the distribution of vaccines, knowing that vaccines are very limited at this time.
Yes. Okay, so in terms of the distribution of vaccines, and not just in Nigeria, all around the world, everybody has to upscale and everybody has to develop the infrastructure. I am aware that Nigeria is doing a lot. They've been saying a lot, and that the government has been putting out a lot of information. We have been told that a first batch is coming in very soon, and we are also being told that the requirements, because these vaccines need to be kept at certain temperature requirements, and they require some specialized freezers. We are also being told that a lot of these have been deployed, and some of them are already in country. The National Primary Healthcare Development Agency has sent out some guidelines, and I'm sure that those are online. They are widely available on how they plan to distribute the vaccines when they actually come in. I don't think that is going to be the easiest of things, but it's not easy anywhere around the world. So we are all just going to have to work together with the government to ensure that we are able to make the most of the resources that we have.
All right, Dr. Itunu, there have been reports of people testing positive and then negative in a short period of time. Is this a problem with testing, or is it a normal occurrence?
Oh, wow. This is something that happens very regularly. And if you recall, I mentioned that what you find in COVID testing, or the outcome of a COVID test, is really dependent on the stage of the infection, right? So it's a very dynamic illness. A person might be just at the incubation phase, and maybe they have their test done on day 1 and they are negative, but in 2 to 3 days, because the viral load has increased, when they have another test done, it then becomes positive. So that's why I said earlier on that your test can only be for the day you had the test done, right? It's the same thing with having a positive test result. A person might be on the downward trend or on the path of recovery, and at the point at which they had their test done, they picked a viral fragment and were declared positive. However, a day, 2 days after, in fact, a few hours after, depending on how that person is able to get rid of the virus from their body, when they have another test done, then it comes out as negative. So these are things that people need to be educated about, because sometimes people say, oh, we came to a lab and the lab told us that we were falsely positive. And I need to address that. If anyone gets inconsistent results, a positive and a negative, please always err on the side of caution. The reason is because the way PCR tests are designed, they are designed to have a lot of controls that make false positives very low. Right now, false positives are about 1 to 2% of all testing. You actually have higher false negative results than false positive results. So I always advise that people err on the side of caution and treat themselves as though they are positive until they have gotten another negative result. So that's some of the things that account for having a positive today and a negative tomorrow.
Okay. All right, Dr. Itunu, since you've just mentioned this, let's talk about the accuracy of some of these tests that we're talking about. How accurate is a PCR? Because we know PCR is supposed to be the main test.
Yes.
How accurate is a PCR as against the other kinds of tests?
Now, the PCR test is the gold standard. It is the most accurate test that we have, though it also has a margin of error, just because of what I had explained earlier. Because while you're sampling, you may not pick the virus in the nose. Maybe the virus is too small, or the sample technique was not properly done. So in that case, you may not pick the virus, and then it becomes a false negative. When you are testing, there can be false positives, and false positives are usually due to contamination in the lab. Maybe somebody's sample that was positive was mixed with another person's sample that was negative. Though these circumstances are very rare, because one of the things that you must pass before you become accredited is you must have high infection control practices. You must have a system that generally reduces contamination. Even though it can happen, you also need to be able to understand what the signs of contamination look like, so that you are able to identify and then call back the client to have a retest done, just to be on the safe side. But that said, PCR is still the gold standard, because you can find a viral fragment from day 2 of infection, which is different from all the other rapid tests. Because the rapid test, you have to go to about day 7 sometimes, or day 10 of the infection before it can even become positive. So you have a lot of false negatives from rapid testing. So PCR testing is the most accurate type of test that you can have right now.
Okay, now, Dr. Itunu, with the growing number of positive cases in this second wave of the pandemic, how can people actually protect themselves?
Well, it's the same advice we've given since the first wave, and now we're in the second wave. You have to protect yourself and other people by doing the following things. Number one, avoid large crowds. Avoid going to places where you are having events and all that. There's still time for that. Let's fight the virus right now. Let's fight this pandemic right now. If you do have to get out there, ensure that you're wearing a face mask so that you can protect other people and yourself. When you wear a face mask, you are protecting others. When someone else wears a face mask, they are protecting you. So we all have to work together by ensuring that we wear our face masks at all times. Not chin masks, not eye masks, right? But on our noses and our mouths to ensure that they are properly covered. Also, ensure that you wash your hands, just regular hygiene. Wash your hands regularly with soap and water. Use alcohol-based hand sanitizers if you don't have access to soap and water at this time. So those are the things that we have to do. Then also social distancing. It's very important. 1 to 2 meters as much as possible and as is practicable. Those are the kinds of things that we can do to prevent or reduce the spread of the infection.
Dr. Itunu, please help me address this particular worry about people, because we've seen opportunistic medical laboratories who are taking advantage of the situation to charge a premium to have people get tested. How do you justify this?
Well, in Lagos State specifically, there is a fixed charge, and it has been made clear to every laboratory, every accredited laboratory, that you are not allowed to charge a kobo or a cent more than the
How much is the fixed charge?
So there's a fixed charge of 50,400 for those who want to pay for it, right? That is those that fall into the want to have category, not the need to have. Again, I must stress that COVID-19 testing is free in Lagos State and is free across Nigeria for those that meet case definition criteria. But if you must pay for the test, in Lagos State, it is 50,400. Other states, I guess, vary a little bit, but in Lagos State, it's 5,400. It is no more, no less. We are not allowed to charge more. We are not allowed to charge less. So if there are any opportunistic laboratories that are doing this, they are not doing this. They are not obeying the law.
So do we have avenues you can, ombudsman centers where you can call to report people who charge more?
Well, that's why Lagos State has done a lot of good work in accrediting laboratories.
Right.
They've been able to identify credible laboratories, and they've been able to advise on the pricing and what they must stick to. And I believe that all the laboratories within that consortium have been doing the right thing. Again, Lagos State is very, very easy to report to them. They have lines. You can always call the Lagos State Biobank if you find that there's any laboratory that isn't doing what they're supposed to do. And they always investigate this. I'm aware that they have a media team, they have a social media team. They do a lot of social media listening so that when anybody is, when there are any allegations, they are always ready to, hear this out and then investigate it.
All right, Dr. Itunu, you've reiterated all the COVID-19 protocols and regulations that we should all try to adhere to. In the UK, the government there has said that just simply behave as if you have COVID. In Lagos here, the governor, Babajide Sanwo-Olu, has said, if you think you have malaria, just consider it to be COVID-19. So what should we do if we feel unwell?
Right. So I agree with that because, the idea is to err on the side of caution. If we all believe that we have COVID, for example, we would possibly adhere better to the preventive measures. Now, if a person feels unwell, what they really need to do, first of all, is they need to, first of all, isolate. Because if the person has COVID, they run the risk of infecting themselves, their loved ones, their family members, their co-workers. So they have to isolate. If they are able to test, they should test. As I mentioned, If you meet case definition criteria, if you do have any of the symptoms, you can call onto Lagos State and even the NCDC network of laboratories and get a free test done. If you can afford it, and if you'd like to go into a private center, there are private centers around that you can go into. If you do have find out that you are positive, there are a couple of things that you need to do. Lagos State, I know, has the Eco Telemed. It's a 24/7 telemedicine platform where anybody who is positive can have a conversation with a doctor, can have consultation, free consultation, feedback, daily conversations, daily monitoring, such that if that person then becomes has more symptoms, the symptoms begin to get worse, and that person needs hospitalization. There are isolation centers that person can go to. There are public centers and there are also private centers. So there's quite a lot that the state has put in place to be able to manage these kinds of things.
Many thanks to you, Dr. Itunu Akinware, for your time here
on
the morning show. That we've been speaking to Dr. Itunu Akinware, talking about the medical officer at the Medbury lab here in Lagos State.